Hey guys, it's Khaki. Today I want to talk to you about something that I hear all the time from my bariatric surgery post-op patients and something that I have struggled with myself, constipation. So let's talk about it. First, what causes constipation after weight loss surgery? To be honest, after surgery, I anticipated having the other challenge, diarrhea. I heard so much about dumping syndrome, and I thought, oh my gosh, when I eat, I am going to be running to the bathroom. That is the experience of a few weight loss surgery patients, but not most. Constipation, the number one cause after weight loss surgery, is alteration of the gut. In bariatric sleeve and gastric sleeve, 80% of your stomach is removed. In gastric bypass, a small pouch is made that starts out that holds about an ounce. Then much of your colon is bypassed and brought up to meet that pouch. So if you think about it, that's a major alteration either way in the gastric system. Something is bound to change, and a lot of times that's constipation. Another frequent cause of constipation after weight loss surgery is your diet changes. We have limited space in our stomach, whether it is bypass or sleeve, and we're instructed to make sure that we get plenty of protein, that our diet should be protein forward. When you get the adequate amount of protein, a lot of times there's not room left for vegetables, fruit, those other fibrous foods that add bulk to stool and prevent constipation. Something else, decreased water intake. We're told not to eat and drink at the same time. A lot of programs say don't drink 30 minutes before eating or 30 minutes after. Tie that into frequent meals. You've got a lot of hours of the day you can't drink. And a lot of people have problems drinking a lot of volume at once. So less water equals constipation. Another thing, medication. Most of us, especially bypass patients, are told we're going to have to take supplements for the rest of our life. Iron, causes constipation. Even in non-weight loss surgery patients, it's something that my patients that take iron struggle with. Calcium supplements, which most of us have to take, are also notorious for causing constipation. Decreased activity, especially in those new post-op days. You're not moving as much. That can really mess with your GI tract and cause constipation. What can you do about it? First off, let me put out there, this is not medical advice. If you're struggling, reach out to your team. But I'm going to tell you a few simple things that you can do. As always, run these by your team before you institute any change in your behaviors or your eating habits, and certainly medication. But here are things that I always advise. Get moving. Move as much as you can. Increased movement adds motility to the gut, which speeds things along. Make sure you're getting adequate fluid. Make sure you're getting that 64 ounces minimum of water a day. Make sure that things can flush out. Also, really work on trying to get in fruits and vegetables when you're able. You don't want to sacrifice protein, but especially after the first few months after surgery, you're going to be able to get in more than just your minimum protein. Make those choices smart choices, things that are high in fiber and that will help with constipation. There are many medications that can help. So let's just talk about those. There are many different types of things that we call laxatives. Let's talk about different classes. Number one, the one that most people reach for first, stool softeners. Stool softeners help just by doing that. When stool sits in your colon for an extended period of time, it becomes hard, makes it harder to pass. Stool softener helps pull a little bit of fluid in, making that stool softer and easier to go. Then you've got what we call osmotic laxatives, things like Miralax, which most of us are familiar with. Those osmotic laxatives, in a greater way, pull fluid into the colon to help things pass. The thing that I see most people get tripped up on, when you become very constipated, that's not the time to take Miralax. Miralax is something that takes several days to promote a bowel movement. And if you're severely constipated, it's probably not going to work. Miralax is more of a maintenance treatment. So if you are struggling with constipation, talk to your healthcare team about whether Miralax is something that you need to add on a daily basis or maybe an every other day basis. Then you have stimulant laxatives. These are things like Bezacodyl, Dulcolax, Senecot. Those actually do what they say. They stimulate movement in the colon to help pass stool. Those laxatives can cause some unpleasant side effects like cramping. But if you're truly constipated, that's probably what you need after you talk to your healthcare team. Then, last off, you've got things like bulk forming laxatives. They're not really laxatives, things like Metamucil. They add bulk to the stool by increasing fiber. However, a lot of bariatric surgery patients will have bloating with these because we don't have that much room. And if you're eating something or taking something that is that high in fiber, like a supplement like that, a lot of times you're going to have some unpleasant side effects. So it's best to try to get that from foods and vegetables. If those things don't work, after you have talked to your doctor or healthcare provider about it, there are prescription medications that can help. Two that I prescribe most often are Linzess and Amitiza, and I have taken Linzess myself. These work on a different level. They're not true laxatives. They're, again, not going to make you go right away for most people. They are something that you take every single day to help promote regular bowel movements. They work on what we call an epithelial level to draw fluid into the stool. They work on, in some cases, calcium. So these are things that are by prescription only, and you and your healthcare team can decide if you need those. So guys, I would love to hear, have you struggled with constipation? And if so, what helps you? Or the other direction, is this something you've never struggled with, but you have the run to the bathroom syndrome? I would love to hear, what would you like to hear me talk about? I would love video ideas. I want to bring forward things that you want to know. I hope everybody has a great week, and I will see you next Wednesday. Bye.